It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Thanks for joining us, folks. I'm Sam Lesante. And folks, as I say to you when we're talking about healthcare in the area, we have tremendous healthcare all over the area, but it gets better and better and better. The Lehigh Valley Health Network always doing something exciting. Today, we have a new doctor starting as pediatrician in the greater Hazleton area, Dr. Alvaro Reymunde, who is going to be here on the Sam Lesante Show today talking about the great things that he's bringing to the Hazleton area. Hey, Doc, welcome to Hazleton.
Thank you, thank you. Thanks for having me.
It's my pleasure. Now, Alvaro Reymunde,
Yep.
okay, certainly not Italian, okay,
No.
even though I wish you were Italian, but Puerto Rican, right?
Puerto Rican,
Yeah.
born and raised from Puerto
Yeah,
Rico.
yeah.
Ponce, Puerto Rico.
When's that?
Ponce, Puerto Rico.
Is that right? So tell me, you look like you're 18, but you're a young guy. Are you married?
I am married. I'm married to my wife, Heather Reymunde, and we have 2 beautiful children, twin boys.
Twin boys?
Yep.
Yeah, well, I know what twins are all about. A boy and a girl. You met them. So what is your wife doing? Is it working? Or just taking care of kids?
She's taking care of the kids for now. She's a civil engineer.
That's a full-time job.
Yep.
Yeah. I'd rather be working than taking care of twins. So you got to give her, some roses once in a while.
Definitely, yeah.
So you're from Puerto Rico.
From Puerto Rico.
Tell me about yourself.
Well, I'm from Puerto Rico. Born and raised my whole life there. I left Puerto Rico for college, where I went to Penn State, up at State College, did my 4 years there. Then I decided to do medical school. My dad's also a doctor, and I figured I would follow his footsteps. And I went to medical school in Guadalajara, Mexico, though.
Oh, yeah?
So that was an amazing experience. It's done a little bit differently down there.
Is it?
Yeah, but it was an amazing experience. That was 4 years also. After that, I did a pre-internship in New York with New York Medical College. And that was also an amazing experience. And then I continued on to do pediatrics in Puerto Rico. So I've been kind of all over the place.
So a couple questions. I always ask people, why did you go into the profession? I think you just said it's because your dad was
Yeah, my dad.
Is he a pediatrician too?
He's a gastroenterologist.
Oh, okay.
Adult gastroenterologist.
So that influenced you to go into the medical field?
Exactly, yeah.
Okay.
Yeah.
Now, when you said you were in Mexico and you said it was amazing, what was amazing about it?
First of all, it was a lot different than I expected. It was, I went to Guadalajara, Mexico, and it was an amazing city. It was a lot different than I expected, a lot modern, very European. And the training in Guadalajara, Mexico, especially in the medical field, is a little bit different. Down there, you see patients from day one. You have clinics once a week. You get hands-on experience with patients, whereas in the United States, you usually don't see real patients in an office setting until third-year medical school. Down there, it's from the first year, and you actually graduate as a médico cirujano, which is a medical surgeon from down there. So you get to practice with a few minor surgeries, and the experience is just amazing.
So what will you bring into this area as a pediatrician?
Well, being from Puerto Rico, I'm completely bilingual, and I hear there's a major need for a Spanish-speaking doctor in the area, given the large Hispanic community that we have here. Also, I think I'm a young guy. I'm bringing some new world thinking into the mix. And my partners, Jim and Steve, I'm sure will give me some of the old world. And I think it's going to be a good mix.
Well, first of all, for the Lehigh Valley Health Network taking you on, you have to be good. There's no question about that. So as a pediatrician, there are different things that, these young, kids get involved with.
Yeah.
What is a febrile seizure?
All right. Well, febrile seizures are, first of all, very scary to parents, especially if they've never seen anybody have a seizure before. What it is a convulsion or involuntary movements that a child can get during a febrile illness. Now, most of the time, it's like an ear infection or a throat infection or roseola, something like that. Any virus that can give you a fever. And then the child will go on to have these jerky involuntary movements. Depending the time frame, there are really 2 types of febrile seizures. They fall into 2 categories. One is simple and complex. The way I started a little bit there was because simple febrile seizures last less than 10 minutes and involve the whole body. Whereas,
what do they shake or?
Yeah, they're like jerky movements of the extremities. So basically, you'll see the kid roll his eyes up. He can foam a little of the mouth. He'll have jerky movements of all extremities in the simple one. And he can throw up and lose some sphincter control also. The complex febrile seizures last more than 15 minutes and usually start it with one joint, one extremity, and then can generalize to the whole body.
So let's go back to how this thing starts. I mean, does it start with a fever?
Yes, yes. Febrile seizures imply that it starts with a fever. Now, it doesn't necessarily mean that the fever is high. It's more of a rapid increase in core body temperature. So what happens is in predisposed children, the kid will get a fever, and these predisposed kids, the brain cells will get irritated abnormally. And then that's what progresses into the seizure.
Wow. So who could have one of these?
So in general, kids and children between 6 months and 6 years of age can have a febrile seizure. That tends to be the range. However, we like to say that 5% of children will have a febrile seizure by their 5th birthday, which is fairly common. And
but it's just, I mean, you got to be careful now.
You do have to be careful. They aren't dangerous per se, but yeah, about 5% of children will get a febrile seizure by the time of their 5th birthday. There are some things that predispose a kid to have a febrile seizure. One is a baseline neurological problem, like if it's a kid who's not 100% healthy, maybe has CP or some other neurological condition, or if there's a family history of febrile seizures, for maybe a close relative had a febrile seizure when he or she was younger.
Mm-hmm. So if a child has a fever, address it immediately. Okay.
Not necessarily. There are studies that show that treating a fever immediately, as soon as it starts, doesn't necessarily prevent febrile seizures. Neither does bringing the temperature down once the seizure already started.
Okay, so to identify if my child's having a febrile seizure, how do I know if it's a febrile seizure?
That's a really good question. So first of all, you have to try and not panic, and really assess. It's a hard thing to do.
Tell that to a mother, you know, and a father. Yeah. So, but I understand what you're saying.
Yeah. So febrile seizures, as I've said, the kid usually has a fever, either before or after, but he has to have a fever. Febrile seizures usually begin within the first 24 hours of a fever. So usually it's the first sign that a kid is sick. So a kid who has been fine and then starts getting a fever and then have these seizures, and then after the seizure the kid is fine again, it's probably a febrile seizure. Now there are some other conditions that can mimic or can look like a febrile seizure. The most scary and the most unfortunate is meningitis. Now, just to be clear, meningitis only causes, meningitis is associated with febrile seizures in less than 0.1%. So it's very rare for meningitis to cause febrile seizures. But it can look the same because you can get seizures with meningitis. But the kids will be progressively getting sick for a few days and then have a seizure in meningitis. Whereas in febrile seizures, it's kind of in the first 24 hours of the illness.
Okay, so take me back here. So I see my child's having some kind of seizure, and you said stay calm. Okay, so first of all, what do I do for the child before I seek emergency care? Okay, what would be the process here?
All right, so let's say little Sam.
Yeah. He's out there.
He's out there. He's playing, and then
little Sam's big now, but
it's big now. Yeah. So the mom sees the kid and he's having a seizure.
Yeah.
So first thing you want to do is keep him safe. Well, first thing you want to do is not panic. Okay. Right? Try and grasp control of yourself, and lay him on the floor if he's not on the floor already, so he doesn't fall and get hurt. Okay. Once he's on the floor, if he's still having a seizure, you just want to make sure that he's not anywhere where he can get hurt. Like you don't want him having a seizure next to stairs or next to a knife or something like that. So if there's anything dangerous, get it out of the way. The other thing you want to do...
Why the floor? Why not a couch or a bed?
So, all right, laying flat will actually help the kid breathe a little easier.
Okay.
And you don't want to put him on the couch or on the bed because while he's having the seizure, he can fall off and get hurt.
Okay.
The other thing you want to do is look at the time. Look at your clock or watch or anything because it's really helpful to the doctor to see how long the seizure has lasted. So take a note of what time it is to see how long the seizure lasts. And pretty much you wait it out. And it's really hard to tell parents this.
Oh my God.
There are some things you don't want to do. You don't want to pin the kid down. He's having a seizure, just let it roll out. You don't want to try and hold him down because you can hurt him or he can hurt you because he's having these involuntary movements. You don't want to try and give him any medication, especially by mouth, while he's having a seizure because he can actually choke on it because he doesn't have any reflex. He's unconscious.
Okay.
Another thing that a lot of parents do is they'll take their kid and put them in a tub of water, cold water. Ooh. Yeah, not a good idea because one, as I mentioned, breaking down the fever quickly doesn't necessarily shorten the time of the seizure. And two, he's having a seizure and you're putting him in a tub of water, he could drown. And that's about the thing. Those are the major things that you don't want to do while a kid's having a seizure.
So what should I do then?
So you should wait it. You should keep him safe.
I shouldn't be calling 911 or...
There are some situations where you should call 911.
I mean, I'd be a nervous wreck.
Yeah, exactly. Well, that's one of the reasons. So what you should do, all right, your kid's having a seizure. If you looked at the clock and the kid's seizure, he's safe and everything, you should call your pediatrician first, especially if the seizure has lasted less than 10 minutes, because that most likely is a simple febrile seizure, which is 90% of the time. And 90% of the time, you'll call your pediatrician, he'll walk you through everything, he'll tell you what to do, and most of the time, he'll just tell you to come to the office the next morning, because these seizures are not dangerous. When should you call?
Okay, so let me stop you right. So, all right, now you're telling the viewer, folks, I'm going to write this phone number down, too, because I'm getting nervous here. 570-501-6400. That's 570-501-6400. Now, you're saying, you're telling people that the seizure will go away. So some people may say, well, okay, I don't really have to call the doctor because it went away. Now, let's straighten this out.
Yeah, definitely, definitely. Well, I'll get back to the other question of when I should call 911, the ambulance.
Okay.
Definitely call 911 if you think your child is having problems breathing. If he starts getting blue around the mouth or the fingertips, definitely call 911, or if he starts throwing up. Or if the seizure lasts more than 10 minutes, you can relax. You can relax.
Yeah. You're getting on my nerves now. Okay.
I think you're past 6 years old. So
Yeah. No, but I'm saying this. Okay. My suggestion would be this: better safe than sorry is always a given.
Definitely.
If my child's having a seizure, okay, there is no way I'm going to. I'll stay calm, but I'm going to be on the phone calling that 911. Okay, no matter what the situation.
And that's fine. Yeah. However, most of these febrile seizures are not dangerous, like I've mentioned. Taking the kid to the ER, a lot of times...
I want you to tell me that. I want the doctor to tell me that my child's fine.
And that's why I say you should call your pediatrician first, or your primary care provider.
Yes.
Because most of the times, taking him to the ER will involve a lot of unnecessary tests and blood work and EKGs and CT scans and all these things, where most of the time, and I say most of the time, that's why I always say you have to call your doctor before you do anything. It's nothing. It'll just happen, and it won't happen again.
Okay. Well, my suggestion is, my prescription is this, Dr. Alvaro Reymunde. You call the doctor, and you bring the child into the doctor, because I want you to tell me my child is going to be okay.
Exactly.
Okay. I don't want to assume anything.
No. You know. It's better safe than sorry.
Things happen. I mean, you see a child, convulsing and shaking around, and God forbid if there's foam coming out.
Definitely. Another reason to call the emergency room is because most times after the seizure, if it's a febrile seizure, most times after the seizure, your kid will be completely fine. He'll be a little drowsy for a few minutes, and then he'll be same old Sam.
So can he have more than one seizure?
Some kids are predisposed to have more than one seizure. In general, of all kids who get febrile seizures, 1 out of 3 will have another one. And of those that get a second, half will get a third. Very rarely do you get more than 3.
Okay.
Things that can predispose you to, for a child to get another febrile seizure are, again, family history of a close relative having a febrile seizure. Again, the baseline neurological problem. If the seizure happened to a kid younger than 1 year old, so under 12 months of age, he is more likely to get a second febrile seizure. And also if the seizure happened with a low-grade temperature. Less than 102 degrees.
2 questions. Number one, you've treated children who had febrile.
Oh, yeah.
Okay. So what did you prescribe, or what do you do when they have a seizure?
So most times when I see a kid whose parents complain of a febrile seizure or the symptoms of a febrile seizure, when they get to me, they're completely fine.
Okay.
So really, to treat a febrile, you don't treat a febrile seizure. The seizure will come and go. What you need to treat is the underlying cause of the fever in the first place.
Yes.
So you need to speak to your pediatrician or your primary care provider, tell him everything you know about what's going on with your kid, so he can find out and figure out what is causing the fever in the first place. You don't really treat the seizure per se. Now, there are a few medications in the market for seizures that can help shorten or prevent the febrile seizures. However, these medications have serious side effects, whereas the febrile seizure doesn't have any side effects.
So they cannot be prevented.
Febrile seizures cannot be prevented.
Okay. If they're going to happen, they're going to happen.
If they're going to happen, they're going to happen. Researchers and studies don't really know exactly how it happens. They know it's an irritation of the brain cells. And most of the time, the seizure is the first sign that a kid is sick. So it's very hard to prevent. And like I've mentioned before, there are studies that, that tell us that bringing the fever down quickly or giving Tylenol or Motrin at the onset of a fever doesn't really prevent the febrile seizure anyways.
Okay. Folks, I'm talking to the new doctor, pediatrician in the Lehigh Valley Health Network, Dr. Alvaro Reymunde. And his number is 501-6400, 570-501-6400. We come back, I have more questions for the good doctor. Stay with us. Welcome back to the Sam Lesante Show, folks. Remember, 247SSPTV.com. All of the health shows that we have done are on that website, and my email is sam@ssptv.com. Thank you so much for tuning us in. Today I'm talking to a new doctor, a young doctor who's bringing a lot to the greater Hazleton area. It's the Lehigh Valley Health Network. His name is Dr. Alvaro Reymunde, and he has twin boys, right?
Twin boys, 4
right.
years old.
Yeah. Well, do you like the area?
We are adapting very well to the area. Yeah. My kids love being outside.
I don't know if I asked you in the beginning, why did you decide to come to Hazleton, and the greater Hazleton
We
area?
were looking for a good place to raise the family.
Oh, okay, good.
Puerto Rico is getting a little crazy for us. And Heather is from actually originally, my wife Heather, she's originally from the Pittsburgh area in Sewickley.
Okay.
And we both went to Penn State, so we were familiar with Pennsylvania. And we like the, you know, the feel you get from Pennsylvania and the smaller town. Pretty much to raise the kids.
Well, that's good. And today's your first day starting?
Today is my first day.
And you're on, you couldn't be any luckier to be on the Sam Lesante. We were talking about seizures, okay? Now, will my child get any other kind of seizures?
All right, so the most common questions parents give me, at least, after a febrile seizure is, will my child get epilepsy? Quick answer is no, not necessarily. In the general population, healthy kids, about 1% will develop epilepsy. Now those
kids... What is that?
Oh, epilepsy.
I mean, I know it is, but explain.
Yeah, okay. So epilepsy is the term we use for multiple and recurrent seizures.
Okay.
It could be any origin. So multiple recurrent seizures, we give the term epilepsy.
Now you have to get medication for that.
Yeah.
Okay.
But that...
So you can tell the difference between whether it's, you know, epilepsy or
a febrile seizure, yeah.
Okay.
Like I said, epilepsy will have multiple and recurrent febrile seizure. Multiple and recurrent seizures. Febrile seizures rarely happen more than one time in a 24-hour period. And most times you'll have one febrile seizure and you won't get another one. So will he have epilepsy? So kids who have febrile seizures are only at slightly increased chance of developing epilepsy.
Okay, do they follow each other?
They do not.
Okay.
So febrile seizures are not directly linked with epilepsy. It's more likely that kids who will already develop epilepsy in the future are more prone to having febrile seizures when they're young.
Could that be prevented?
Epilepsy, there are drugs and medications to help with epilepsy.
So you won't know a child has it until they have it?
Epilepsy, yes.
Yeah, okay. So seizures shouldn't be taken, you know...
They should not be taken lightly.
Lightly, okay.
No, definitely not. You should definitely call your pediatrician if your child is seizing. But like I said, febrile seizures are not harmful. They do not lower IQ. They do not cause mental retardation. They do not cause brain damage. In 2008, the American the American Academy of Pediatrics threw out some guidelines on this, reassuring pediatricians and parents as well that febrile seizures are not harmful. Again, that treating the fever rapidly or at the onset of fevers doesn't really shorten the time of the seizures. And most of all, that they're safe. They don't cause any brain damage or anything of this sort. And there's a, I think it's a cool little study from 2001 in the journal Neurology. They took 6-year-olds and divided them into 2 groups. One group had febrile seizures in the past and the other one did not. So it was febrile seizures versus no febrile seizures in 6-year-olds. And they gave them IQ tests, memory quizzes, like all these cognitive tests to see what the difference is. And interestingly, the group with febrile seizures scored higher on everything than the kids who never had the seizures before. Right? Now, I'm not saying you should go and give your kid a seizure.
Hey, have 2 seizures because I want you to go to college.
But I mean, parents can take a sigh of relief.
Yeah, yeah. So really no brain damage, etc. Thank God for that.
No, if it is a febrile seizure.
So they're treatable if there's something serious? Okay.
Yeah, the condition which causes the fever in the first place, depending on what it is, could definitely be treatable. So
I'm all for preventative. As my wife's a registered nurse, and she always sends me to the doctor, even though I don't want to go because I'm the big baby. I want you to know that. When they say Sam Lesante, he is a big baby when it comes to. My wife has to push me to go to get my physicals. But anyway, health care for children. Okay, what should be? You know, we're coming into seasons. You know, different kind of seasons. Yeah. What should a parent do for health care for their children?
Well, it depends a lot on the kid's age, right? You should definitely see your pediatrician at the time, at the appropriate times. And very important, especially coming into this season, the flu shot should definitely be done. And now for
how old?
Since 6 months up.
Flu shot, 6 months up?
6 months up. And now there's a...
Is there, okay, when I don't get a flu shot. Last year, the girl that was here last time, Melanie, said I should get a flu shot. Maybe I'm going to have to get one. But when you get a flu shot, some people say, well, if you get a flu shot, you get the flu. Yeah, is that true?
Well, you get symptoms of the flu. You can get a
Why
little...
is that? Because that's only some people now.
And some people, yeah. Well, there are 2 vaccines, right? There's the shot, which is the injection. Yeah. And that's a killed virus, right? It's not a live virus that you use.
So I won't get sick from that?
You could get a little sick. You could get sick for a few days.
Okay.
But it's nothing like getting the actual flu where you could end up hospitalized.
I could still come to work, right?
Definitely, yeah. Okay. A little box of tissues there for you, and it'll be fine.
Okay. I'll have tissues there. Thanks, Alvaro.
The other flu vaccine that you can get is the nasal mist, right?
Yeah.
And that's a live virus. Some kids can get a little bit more symptoms with that one. But the American Academy of Pediatrics is now recommending the nasal one because it seems to protect you a little bit more.
So 6 months and over, get a flu shot.
Definitely, yeah. Okay. Better be safe than sorry. And even if you get a little sick, it's nothing that you're going to be bedridden, and it's definitely a lot better and safer than actually getting the flu. Because the flu can make you a little sick, but in some kids, especially if they have other conditions, you can get very sick. Now, there are some contraindications to getting the flu shot, but you should definitely call your pediatrician and have him orient you based on the conditions that your child may have.
In your experience, what has been the most common illness that children get?
All right.
I mean, there's tons, but what is the most common?
The most common, again, depends on the age group.
Yeah.
Little babies, moms come in with complaints of constipation all the time. Basically, when
I have a solution for that.
Oh yeah.
A little shot of scotch will do to take care of that.
Do not give your kids scotch.
Okay. No, so that's seriously. That's
constipation, yeah, because when newborns poop like every half hour, right? They poop all the time, and then as the kid's getting a little older,
they're full of poop.
They're full of poop. So as the kid gets a little older, he won't be pooping as much. Maybe once a day, once every 2 days, and then parents start freaking out that their kid's constipated. Yeah. So that's probably the most common.
So it's really, there's nothing wrong with the child then, right?
Most times, no. It's just normal development.
Normal development, okay.
Another common question that we get is spit up. My kid has reflux. My kid has milk intolerance and all these things. And more often than not, it's just spit up. And it's not an allergy to the formula or the breast milk or anything like that. That's the most common scenario. But you still, if your kid's spitting up and you're worried, you should definitely take them to the pediatrician to get it evaluated.
Well, I mean, of course, you know, they should go once a year for they get the various vaccines for all the, et cetera. Well, Dr. Alvaro Reymunde, welcome to the Greater Hazleton area.
Thank you.
Please say hi to your wife and welcome her and those two beautiful boys. And what are their names?
They're Angel Gabriel and Xavier Andres.
Oh, yeah? Now, what's the English names?
Angel and Xavier.
There you go. Okay. No, that's beautiful. So, and your dad's a doctor. Is your mom still living, too?
Yeah, she's living. She's a pharmacist down in Puerto Rico.
The whole family's in medicine.
Whole family's in medicine.
We wish you the best, okay?
Thank you so much.
You're working with great people. Dr. Casiano is a great guy. And
Dr. Glicken?
Glicken, very nice people. It's so nice to see that we have young, vibrant doctors coming into the area. Melody, you're doing a good job, Melody. You know, folks, his name is Dr. Alvaro Reymunde, and his phone number is 570-501-6400. If you need him, please give him a call, and he's a great guy. Thanks for joining us. And remember, 24/7, all of the health shows that we've done are on our website. So if you want to go back and review some of the things, get some free medical advice, that's the place to go. And thank you so much for making the show as popular as it is. We'll see you next time.